Usually, um, we're from a small town, and so we don't take someone to a morgue or something like that in a facility. So primarily what you're seeing, the role of the nursing assistant would be to bathe this person, to prepare to send them out to a funeral home, uh, then also to assist the nurse. Any kind of artificial tubing, anything like that, IVs, any NG tubes, anything like that are removed. Um, you always want to clean the environment, get rid of all the medical equipment in there, any trash in the room, uh, make them look as natural as possible, and give them a bath, comb their hair, and put a clean gown up on them so the family can come back and spend a little time with them, because it's a very traumatic time for families, and some families would like to stay with them for quite a while, and some just want to go in briefly. But a big part of providing postmortem care is not just taking care of the body, it's taking care of the families too at that time. And I have found in watching families that they really appreciate that aspect of you taking the effort to make their person that they love so much look more like themselves and not like a sick person lying there with all this equipment on them. The RNs now in Kentucky can declare death. They are allowed to declare someone dead. What they have to do, the nurse on the floor, whether it's an LPN or an RN, would, if they come in and someone has passed away or they've been with them and they pass away, they call the doctor. If the doctor's not in the building, they would notify the family if it was an unexpected death. And sometimes you do go in and someone has just passed away in their sleep and the family is not there. So they would have to notify the family. Uh, they would have to call the funeral home. There's a lot of paperwork that has to go into being efficient, I guess, at that time. And if it is an unexpected death or a suspicious death, you would have to call the coroner also, would have to come in. And LPNs can assume all those duties, except they cannot declare a person dead. It has to be an RN or a doctor to do that.
When you talk about staff too, a lot of times these CNAs care for them, and they care for them every day, 24 hours a day. And a lot of times they're given that final care. They're given that final bath, combing their hair, that final time. A lot of times that helps them with their grief, because they took care of this person and they're very much this person's life, and vice versa. And that gives them some satisfaction, as that person was there and expired there with them, and they got to see them through to the end. So that helps them some with their grief, as far as it's what I've seen with CNAs and the nurses, because they got to care for them from the beginning all the way through to the end. And a lot of times when you send them out to the hospital and they die there, the staff does not have that closure where they got to do that final care.